Hey, it's Diana and Susanna, your favorite global health scientists.
And you're listening to Global Caveat.
Today, we're going to talk about community health work, responses to pandemics, and the implementation of international aid.
But first, thank you so much to all our supporters who make Global Caveat possible. Take a couple seconds to give us some stars, share us with your loved ones, and leave us a review. If you want to further support us with your dollar bills, you can sign up on our Patreon for just $1 a month.
Yes, please support us. But now let's dive right in. On today's episode, we'll be talking with Zuleka, a storyteller, head wrap enthusiast, and a PhD student in planning, governance, and globalization at Virginia Tech.
Hi Zuleka, thank you so much for your time. I know you're busy. PhD student and all that, so I appreciate you.
No, thank you guys for having me. It's exciting.
Yeah. So if you could provide just a short intro about who you are and then any contact information if people want to reach out to you.
My name is Zuleka. I am currently a PhD student. Doing a PhD in planning, governance, and globalization with a focus on study abroad experiences, particularly in Africa. I am also simultaneously completing my MPH with a focus on education, the education track. And I am identified as an African American. I am a Liberian American. My family migrated to the U.S. from Liberia in West Africa. Mm-hmm. And I moved to New England, Providence, Rhode Island, and now I'm in Virginia with my fiance, and we're both PhD students here at Virginia Tech.
Wow. Both of you are PhD students?
Yes.
How's that?
Oh, man. Our lives are, papers. Yeah.
Papers and reading, I bet.
Pretty much, yeah. At least it's nice to have someone who understands that we don't have no date nights, we don't have nothing. It's just that. So it's nice to have that.
Yeah, I can't imagine. So cool. I didn't know that your fiance was also a PhD student.
Yes.
Okay, so let's go straight into then your experience in working in public health settings. You've had a wide range of experiences.
Yes, so immediately out of college, I did my undergrad in psychology and cultural anthropology at Northeastern in Boston. So immediately after that, I got a job at a hospital in Boston, and they had a violence prevention team. Previously, I was into doing health education for my co-op education or my experiential learning experience. I worked at a high school, a local high school that I used to go to, talking about sex education and all of that kind of stuff, because I have no problem talking about stuff like that. So I felt very comfortable standing in front of people and talking to them about sex and making all these posters and talking about STDs and watching the look on the students' faces. So that was my first experience. And then I got this job right out of school, and I worked on a violence prevention team. But I didn't know what I was signing up for. I thought I would just be talking to people, about stay off the streets or something like that. But it turned out it was actually like talking to people who were involved in violent accidents and gunshot wounds, and it was just way above my head. I didn't know what I signed up for, but the violence prevention team ultimately was to work in a community. We're trying to get people to do some kumbaya stuff, like get gangs to talk to each other and sometimes it was talking to mothers that actually lost their kids. So it was really heavy for 2 years for someone who was just out of college, barely with any experience of what I was doing and coming from talking to high school kids. But working on the team, it was an all white, it was a lot of surgeons on the team, and there was me and another person that was on the outreach team, and I felt like I was put in the middle of this thing. I had no idea what was going on. We would go to rounds, and where you had the social worker, the actual medical students, the surgeons talking about their experiences and what happened, and then they would say, "Oh, we're here from the street team or the violence team. What's life like out there? What are you guys doing? How can we help our patients? Like, what did you guys learn about what's going on? Was there a stabbing? Was there a shooting?" And sometimes I'm just like, I really don't know what I'm into, and I feel like I was put in this spot sometimes to speak for what was happening in the hood, so to speak. And I had no idea what was going on. I was just this kid, from Liberia. I just moved to the States, went to school, and I was just comfortable talking in front of people. And then I was tossed into this role where I had to report and then talk about my experiences on the street. Sometimes they're like, oh, we have this patient. It's really interesting to go through the case and say this person got shot, and, you know, you're not a social worker, but we want you to go in there, like, just to break the ice and have a conversation, just to see where their hair is at. And I go in, and sometimes I didn't even know what to say, like, hi, or like, what happened? Like, I never knew how to start these conversations. But that was like my first.
That's interesting. Because it's like, if you're not trained to.
Yeah, I mean, exactly. You said you're not a social worker.
In those
and then they didn't train you how to do it.
No, it was just like, oh, you have some experience working with street youth, whatever that means. Uh-huh. And it was like, okay, so you're on the street team, you are the outreach person, so you're going to be talking. My official role was injury prevention and violence outreach coordinator. It was this long thing that I thought I was just like, okay, I'm going to be reaching out to people, talking about ways to prevent violence, which would be maybe like, so I got some courses in violence prevention strategies, but none of this was about like actual street gang violence. I feel like it was just way over my head after the first year.
Do you think so the team that you were working with, like the social workers and the surgeons, did it seem like the team as a whole did not understand the context of the group that they were reaching out to, or was it just kind of...
I think it was just one of those, like, check the box, like, we're doing some community outreach, because the area in Boston where, like, in Mattapan and Dorchester and other areas, there was a lot of violence going on. So I think they were getting a lot of their patients from that area, and maybe the assumption was that I was from that area, or I knew people from the area. Because even the hiring process, like, I was, like I said, I was right out of school. It was really shocking for me. And I was like, wow, really? Because this is a prestigious hospital. I went in, and I was looking for any outreach position, because ultimately I didn't want to sit in a cubicle. So I was looking for a way where I would be out there, like, doing some presentations and then coming into an office somewhere. I just didn't want to be in a cube. So this was perfect. I read the description. I was like, oh, you get to go out. You know, there's a street team, there's a community outreach, everything, all those words just sounded. And then I got in. Right there at the interview, they're like, you got the job. I mean, I was like, great. And I really learned a lot. Like, obviously, it wasn't as terrible, but it was heavy stuff. Sometimes I went home after, like, they had a peace walk that they did with women that actually lost their sons. In Boston, they still do this every Mother's Day. I went to a couple of the walks with my mother. But this was heavy stuff for someone who was just, like, 20, right out of college. And I was like, I don't know what I got into. And ultimately, obviously, that's why I didn't stay. After, like, 2 years, I was like, no, I gotta go. This is like, I thought maybe I'll have a life in public health, but not that route. Like, I knew I wanted to do something educational related, but I was in the hospital and I was on the street. And I was actually meeting people that lives has been impacted by violence from the street. This was just a lot.
Wow.
That's really heavy. That's really heavy role to step into literally right out of college.
Yes.
Yeah. I don't even know what to say, because that's...
Yeah, I mean, I learned a lot from that. I think like you said, populations, like, just dealing with, because it was like two different worlds. I feel like when I was in the hospital with the surgeons and it was different. I got to wear a lab coat, a white lab coat. I was like, I feel like I'm in Grey's Anatomy. Like, it was just cool. But then when you were out in the street, it was a whole different world. And I feel like I didn't fit in both of those worlds. I was not a practitioner. And then on the street, the other person that was on the street with me, he had worked in New York with some street kids before, like, doing some graffiti art projects. So he was really committed to this work, and this is what he wanted to do. And here I was, this young kid out of college, just walking wherever they wanted me to go. Sometimes I sat in on meetings with mothers. Sometimes I went to, like, gang intervention, but it wasn't as scary as it sounded. It was just a bunch of young kids, like, just up to no good, sitting around having conversation. And they had funding that they provided, maybe to say, like, there was pizza night. So we have, like, a night with kids, in hopes that night spent at the pizza night would be a way out from doing something.
Yeah. How did you then find ways to connect with the community that you were working with? Like you said, you didn't really come from that world. I'm putting that in quotes.
Yeah. I think I learned a lot about myself and about them. I met a lot of kids that were just like at the wrong place at the wrong time sometimes. At the time I had dreadlocks, so some of them show me where I could get my hair done while I was in Boston. So I think I made a lot of connection with people there, but I think I learned a lot more about myself because I thought I was like this cool young kid, like doing my thing. And then that world was just completely different from what I grew up knowing. And if side of Boston because it's a college town, all these different people, but that side of being right in the middle of Boston was just completely different from what I thought Boston was about and from what I knew. So it taught me a lot more than I don't know if I give them a lot more, but I think like for me personally, I learned a lot just from that experience.
Yeah. So you were there for 2 years. What did you move on to after that?
So I was there for 2 years and then I moved back to Liberia. So at the time, I lived in the US for over 10 years by then. And the war was over, things was going back, and just being on the street most days, I'm just like, I feel like not useless, but like I said to you before, I don't think this was for me. I just feel like everything was over my head, and I feel like I could be doing a lot more, helping with Liberia development, being in touch with people and my friends on Facebook and other means. I realized like I could do a lot more being there, even if I didn't know or have a lot of experience. I feel like I had to be a part of something that was going on, and especially hearing from my friends or young people that have moved back from the diaspora to the continent, I feel encouraged and I wanted to go back. So I did move back after that. I worked at a university there, helping them with recruitment. Again, I was out in the streets and the community again, helping with recruitment, getting people to go to the university. It was one of the only two government university in Liberia. It was all the way in rural Liberia. So that's where I ended up. So I left from Boston to the village life.
That's very different.
Yes, that was
lifestyles. Different. Yeah. How challenging was it to do that work?
It was challenging. It was different. It was a lot of adjustment. Considering when I left Liberia, I was a lot younger, so this was not what I remembered. And the war has changed a lot of things and people and places, so it was different for me. It was different. And then being there for the short while, right there, then the Ebola time happened. So that was definitely a different time and awakening in connection to public health. It was a different experience.
What was that like to be there during the whole Ebola crisis?
So I was not there for the entire thing, but when it first started, I was there and I had to come back to the States. And just that experience for me, being quarantined, getting the Ebola phone at the airport, and just the stigma getting back here to the States, that it was just a lot. I left from Hopper, got to Monrovia, and I flew into JFK. When I got there, even before I got there, because usually there's not a direct flight to Liberia, so I flew through Brussels. Just the stigma, just having been on the plane with a lot of people coming from Liberia, I feel like at the time, it just started. It was sometimes around July. I think it broke up in April. So it wasn't as big. And the first case in the U.S. had not happened at the time. So people were still on the edge, but they knew of something coming from. So people were, a little hesitant talking to me. Even when I got to the JFK area, I was told that I had to, all the people from Liberia had to be in a separate area, even though we didn't have anything, but I just felt like the treatment was very different considering that I've been back and forth a lot of time. And then I was given this phone that we called the Ebola phone. It was a little flip phone. I haven't seen a flip phone in a minute. They gave you a flip phone and then you had to call every evening to give them your temperature. They give you a little kit thing to give a temperature, and I had to do that for a whole week just to make sure that you were okay before you could go on with your life pretty much. So and then after that you just dispose of the Ebola phone. What? So yeah.
Okay. You just throw it away, or
I don't think they wanted to touch it after. So they're like,
what?
I was like, oh, after your last call, I said, is this it? They're like, yeah. And then what do I do with the phone? They're like, it's yours. You can just keep that. So yeah. It was different. Okay. It was definitely a different experience.
When you say different, is that like what kind of different? Because I feel like with quarantine situations, there's a lot of like human rights conversations come in because people are like, oh, well, we have this health crisis. So then if there's this health crisis and if you've been potentially exposed to it, for the health of not just you, but everyone else, we're going to quarantine you. And depending on the level of quarantine, a lot of your rights to do things are taken away in a sense. So yeah, I guess how was the quarantine experience? Because I know that's maybe compounded with just the general society's response to you coming from Liberia. Yeah.
I think the experience at the airport, I don't think I was quarantined for more than like 2 or 3 hours. We just had to wait at the airport because they were taking temperatures, coming back. Like I said, I have family members it was actually worse. They had to stay overnight or 2-3 days. That's for me, it was just like it had just started. My mother was going crazy and saying, you gotta come home, you gotta come home, you gotta come home. So I left Liberia and I think I actually landed July 4th, which is like a holiday, but I feel like the treatment I got obviously was different than usually. We had to sit for a while. They did the temperature, came back. People were wearing, masks and gloves. Like it just felt like you were being treated like you had something, even though you didn't. And for someone who was in Liberia and I know how deadly it was, I understood, but I just feel like the eyes, people looking at you. That encouraged me when I came back. We did start the Ebola Be Gone challenge, trying to get people to donate because the health situation in Liberia is terrible. Obviously, that's why the Ebola lasted as long. We didn't even have, like, where I lived in Hapo, if I stayed, there was no ambulance at the time. They had no way to get people from there to, like, the centers that they established in the city. So there was a lot of reasons why people were that way. But I don't know. I feel like the way I felt I was treated at the airport, it was not necessary. Even the people holding your passport differently, like they didn't want to touch it.
Like this?
Exactly. They don't want to touch it. They're taking out their gloves, even taking precaution, I guess. And then when I got back and integrated into regular society, the same thing. Every time I met someone, because I'm very proud of who I am, I tell people sometimes I'm Liberian American, and that was just like, whoa, when did you go? How often do you go? Were you there lately? And you have to be saying, no, I don't have Ebola. I wasn't there. No, like it was a lot. And then when I went to churches and school, because I was speaking at different places, trying to get people to donate. Every time I went, I'm from Liberia. People, they don't really want to shake your hands. It was, the stigma around it was a lot more. And I think it comes from like the lack of education. Not a lot of people knew. Just like now with the coronavirus, I just had a heated argument with someone this morning that said, I'm not going to Chinatown because of some nonsense. And I'm just like, you are just so ignorant. So I think that was, people just heard Liberia and they heard Ebola, and that was enough to stay away from that. So
yeah, that's really sad because I feel like, you mentioned the coronavirus, but it's weird because when I travel, I like to wear a mask. Especially when I'm sick, I like to wear a mask just for like courtesy. I don't cough on the person next to me. But I remember it was kind of in the beginning stages of when coronavirus was hitting the news, and I was in the airport and I was wearing a mask, and I felt like more people were staring at me. And it was weird, because you're like, I know for a fact I don't have it.
Yep.
Yeah. I'm not even Chinese. Like, I haven't gone to the Wuhan region at all. People will see what they see.
Yeah.
And then they'll make those connections. And so, I don't know, it's saddening to me that it's like, it doesn't matter where or what, if it's in a country that's other than yours.
Yes.
And you fit whatever
I think it's
description
that thing
they
of
have.
other. Yeah. I think people just don't know. And it might come from a good intention or a good place, but I think people really don't know. Especially now with the coronavirus, people are very ignorant about where everybody from any Asian country has, like, it's just sad that people can't differentiate because for them it's just other places and they have no idea investing the time in knowing where it is. As big as China is, they just need to hear anything that's related to China, and they're like, nope, not taking my chances.
Yeah. What are your thoughts and feelings about the international response to the crisis in Liberia?
I think people didn't care until it got to the U.S. And for someone who lived in Liberia, I can say for a fact there were a lot of people dying and things going on. And a lot of it was lack of education. People didn't believe it was such a thing. And then, like I said, there was not a lot of ambulances. There's a lot of breakdown in the system, obviously. But people didn't care. If you didn't live in Providence, Rhode Island, where there's a lot of Liberians, or some other place, you didn't know what was happening. It was not on TV until that one guy came to Texas from Liberia. And then it was like, oh my God, I can't talk to anyone from Liberia. And it was such a big deal out of that. I think a lot more people, there was a lot of doctors from Cuba that went. There was a lot of doctors from a lot of different places that helped a lot in the crisis. And we're forever grateful. I'm really happy about the help that people give. But I think a lot of times things are not as important until it's on American soil or maybe UK or somewhere else. And then people are like, oh my God, this is actually serious. And people continuously say now, like the coronavirus, is it here yet? How many people, people are taking all the precautions. And I was listening to BBC this morning, and they're like, oh, I think the first case of reported someone in Egypt. They're like, it's on the continent. And people are like, oh my God, they're freaking out because they know for sure that they don't have the system for that. And I think there's only one testing center, and it's in South Africa. So I think people are taking precaution all over the place, but specifically here, I think the ignorance around it is what people are paying attention to more.
So once it got the attention of the U.S., I imagine then more U.S.-based health workers were then heading over to that region,
yes,
right?
There was a lot more U.S. intervention, a lot more people everywhere else, Europe and everywhere else coming to the aid of both Sierra Leone, Guinea, Liberia, and all the other places that were.
And were you there in the later stages of the whole crisis?
No, I was not.
No.
So I did not go back until probably a year after.
Okay.
Yeah, but there is, obviously I was in touch with people and family. Did lose a neighbor's son that I knew, and some few other people that I knew.
Wow.
You're already mentioning, or Susanna asked the question about how there were people going there, right, in response. But it's interesting because it's true, right? A lot of the world doesn't care or doesn't really think about it or react until it starts affecting people in global north communities and areas, right? If it doesn't hit somewhere in the US or the main countries in Europe, then people are not really responding in a way where they're like, oh, we're going to try to help everyone. They're just everyone get away from us. Which is, just quite frankly annoying.
Yeah.
For no other way to say it. So do you think that having that kind of response is actually, what are your thoughts on having that type of response where all these people, what are your thoughts on global north responses to international aid or international responses to these type of quote unquote crises?
I think a lot of times it is already a crisis before they realize it's a crisis. And it's not like the world just decides something is happening when they decide something is happening. So I think a lot of times there's community groups already on the ground doing the work. There's people doing the work. The truth of the matter, they might not have the resources. So if people from here would just show up, and give hand like they're supposed to. And then, because people literally are dying. And if you have excess resources and you want to help, you should do that. But I think a lot of times people rush in because, one, they want recognition. Two, they're doing it not for the fame, but they want people to say, oh, look, the Red Cross sent 20 people here and this is what they did, this is what they did. Instead of saying, okay, they're collaborating with, say, a local group that is already on the ground. They just don't have an ambulance to get to where they need to get to. So maybe they can just donate that. But I think a lot of times the way the global north response to crisis is to not make it bigger, just blow it up bigger than it is. And this scare tactic of, especially now, the coronavirus, oh my goodness, the way they report, the way they're reporting, the way they're saying things, no wonder why people are afraid of saying, I'm not saying it's excusable to say I don't want to go to Chinatown, but they make the media play such a huge role in how people react to a situation that is not in the US or anywhere else in Europe. It's so terrible. They show these images that they won't ordinarily show if it was the US or anywhere else. They show people at their worst conditions that you won't the images that we put out sometimes. And I think I talk about this a lot on social media is what story are we trying to tell? If someone's dying, a sick baby, why do you need to show that as someone who's actually intervening in the crisis? Are you not busy doing the work you're supposed to do? When do you have time to do that? So I think it's not wrong how they respond, but I think they, one, overhype the situation that is not needed, and two, they're not trying to collaborate with people who are already doing the work. They're only looking for more funding from their donors. So they just say, look at me, I saved 4 people today from this burning building. So and there's people actually on the ground that probably saved 20 times as much, but they don't get that recognition. They don't get that thing. And I think, like I said from the beginning, I think things are happening already. I don't think people are going to be sitting there dying and just sitting and waiting for intervention. Sometimes, a lot of time, the intervention come in either towards the end or just because it's a big enough of a intervention or aid. That's why people get a lot of recognition.
Yeah. I think what I keep thinking is how health, when it's framed as a security issue, that's when Americans really get scared, right? Because if you think about it, a lot of the othering and scare tactics, it's always packaged in our security is in threat, whatever security means to you. And so once Ebola lands on American soil, all of a sudden every American life's security is in threat. Yeah. Mm-hmm. And same with coronavirus. So, and I have a lot of thoughts about just the framing of it as a security issue. Because we see it time and time again in how they report it and how they do that. But I did have a question leading up to it, but now I got angry and then I forgot what it was. You talked about how, sometimes what we need is collaboration, right? And a lot of times it's like just the lack of resources, but people have the ability and the skill to address the issues on ground. So it makes me think about this whole kind of savior complex that not just people individually, but like whole nations can have or whole governments have. Especially with like Western countries. So it made me think of how you kept mentioning, there like no ambulance like system. And then I feel like during the Ebola crisis, a lot of the news outlets were faulting the Liberian government and faulting the Liberian healthcare system for not addressing the issue. And I feel like we hear that a lot in terms of just Africa as this monolithic continent, right? Like all of Africa is corrupt and all of Africa doesn't know how to handle things in general. And, what is your response to that? Because I hate that, number one, but as someone from Liberia and, what is your response to such ideas?
Ooh, that's a loaded. I don't know if we have time to talk about Africa corruption. There's a lot of issues. I think one, we talk about framing is how people frame. So obviously, if you create a narrative that people are helpless or people are corrupt, they can't handle their own money or they can't handle their own crisis, obviously that creates the opportunity for me to come in. If I want to come in, I have to tell you a story of why. It's like if my neighbor was beating on his wife and I told you, that's the reason why I broke down his door and did this and did that, because he was doing this. That makes, for you, you're like, but if he was just sleeping, minding his business, watching his Netflix, and you came and did that, that's different. So I think the idea of Africa being corrupt and being helpless and being poor and all of this thing, that has to happen for the West to be who the West is. That has to happen for us as people because I feel like I'm in this crossroad of both being in the West and being from Liberia. Is like, in order for you to have poor people, you have to create this narrative that is like, they can't help themselves, they need my help. Liberia government is corrupt, that's why we have to go in and help them. They're all just going to die off. They don't have ambulances. So the conversation was never the situation or systems that's in place. That why is it that they don't have ambulances in a country that have over 4 million people? Why is it this country, as Liberia as it is, was founded by free slaves from the Americas? So because of American slavery that they had here, they decided, people are free, they should go back to Africa now. They had nowhere else to put them. But they said, we can find a land somewhere and bring them back. And this is how Liberia came to be. Even though there was people already on the land, sounds familiar, they were like, hey, let's go and create this place. And that's how it's fun. So they have a bunch of people who have never lived on this land before. They bring them back. So the natives and people who were returned from America, they have this crisis. So Liberia's always been over 2-3 decades of crisis. Civil wars here and there from 1847 till like now. So all this system of things is happening. Of course, they can't govern themselves because these are people they were doomed from the beginning. They had a country of returners and natives fighting all the time. There was never no reconciliation up until now. After the thousands of people that died in Liberian war, there are no one that was held accountable. There's no one who went to jail. People just went about and said, okay, well, now back to regular peace building, whatever that. So I think there's systems, there's history of places, that those things never get told. It's just like, they're poor, they have no ambulances, and they're corrupt. So we have to go and help them. Am I saying Liberia is not poor? Absolutely not. Am I saying that people are not corrupt? But the systems that are in place is not a system that people are going to live a life. You can't live off minimum wage. There is no system that has a minimum wage of people working and getting a job. Everyone depends on NGO. So we need the NGO aid. So it's almost like we're relying on aid, international aid. So they have to keep creating this narrative that they need us. And the truth of the matter is, as it stands right now, everyone needs all the aid they can get, because from time in existence, there's never been a time that I can say it had a great healthcare system. No, we've never had a healthcare system that worked because half of the doctors or people that are educated, like myself, ran away during the war. That was started because of conflicts of natives and returners. So I feel like it's a long history, and that's just one country in Africa. So imagine all the other people that have been on the colonial rule for us since like 1960s and 50s. So like few years ago, people still had like colonies in Africa. So I feel like the conversations are always one-sided. It's like, let's blame the government. They can't take care of the people because the government that's in place have never had anything. It's almost like you just have people in control to say we have a president. But is it really? If 70 or 80% of their income is from foreign aid, of course they're not going to. If you give me $10 and you said, hey, I want you to buy Starbucks. If I've not had food all day, I'm not going to buy Starbucks. I'm going to buy something else. So a lot of times the corruption is mismanagement of funds because people are redirecting foreign funds. Because in my case, say when I worked at the university, we would get aid and they say, we want you to open an e-library for people to have Skype conversations and video calls. The students don't have chairs. They don't have food. Why would I build an e-library when I can just buy chairs? So in that situation, they're going to say, people in Liberia are corrupt. When we give them $10 million to open a electronic library system. No, we didn't do that because they didn't have chairs. They didn't have a blackboard. So I think a lot of times the corruption is just a mask that is thrown over mismanagement of funds because people are on the ground. Am I saying there's not corrupt people in Liberia or Africa? No. But I'm also saying that sometimes it's the entire story is not does not get told. And this is why a lot of times online I'm mad about, and I'm not saying people are not poor. I'm just saying the West is the one who's telling the story. And until like the animal gets to tell the story, the hunter will always be the hero.
Mm-hmm. Yeah. So then what are your thoughts on how communities and organizations, how can they do better? Because like you said, Liberia needs the aid right now. So I think it's very easy for international aid agencies to have very paternalistic intentions and views about the aid they're giving, i.e. the whole history of international aid from the U.S. But how do we balance like the need for aid versus having equal power in between the giver and the receiver of that aid?
I think a lot of times the conversation about aid starts at the wrong side of the table. I think people here in the West decide like, okay, we have $10 million. What should we do? We should go to Africa and help. I think the conversation should start the other way around. I think people should be in Africa saying, I've lived here or I worked here or this is what I've done. And I see that people in Liberia don't have this. They don't have this. They don't have this. And then on the other side say, okay, you have $10 million. This is what we need the $10 million for. But people are channeling programs to match money that's already available. So someone says, I have $10 million for AIDS education or for, free condoms, but this is what it's for. And so they bring the money and then people in Liberia would create programs or make things happen because they want to fit this narrative of what the donors want. I think INGO decide what they want to do. They have their goals. If your INGO is focused on education, that's what you want to do. So you're going to go to every low African village and give backpacks and pencils, and this is what you want to do. Instead of saying, okay, they need backpack and pencils, well, there's also a lot of malnourished kids in that village that you could probably start a food nutritional program with, but that's not my goal. My NGO is only for backpacks. Do you understand? So I think a lot of time aid work is directed, is channeled to follow what the international organizations or the NGO want. And I think that's to do better aid work is to collaborate. We've talked about this like a lot of times. It's to collaborate. And sometimes collaboration from Kenya is not going to work in Tanzania. It's not going to work in Liberia. Just because you worked in a village with women, they're not the same. Just like here, people in Virginia are not the same as people in California. So you don't expect to have one copy and paste program that worked in Tanzania and now you're like, okay, pack up. We're going to do the same backpack program over here. I think people need to think about working with people as they're people. They're poor people, yes, but they have needs. They have different needs. People are complex. People are different. Just because they're poor does not mean you can just be like, okay, let me just give you a backpack. Of course, they're going to take it. a lot of times being in Liberia, I know people come in, the local NGO will take all your old clothes, all your shoes, your old computer. They don't even need that, but they're going to take it because, people feel good about it. They take pictures, more computers and backpacks is going to come. So they're going to take it. So I think the conversation about aid should start where you want the aid to end. It should start at the end where you talk to people that actually need, and then you figure it out. Then you build programs around that to fit that. And a lot of times people who come in with the money are the ones. So most times when you hear NGOs say it's a collaborative effort, is it really? Because if you have the money and you say, you know what we should do, let's build a hemp pump, they're going to say yes. So I think the conversation should start without any idea of what you want to do already. If you came in and you said, let's figure out what this community needs, and then in that order of priority, we build programs, that's a different thing. Obviously, if it's a public health issue, if it's something that's, people are dying, that's a different, you don't have time to do that. But if you really want to make impact, long impact, sustainable impact in the lives of people, you should start where the people live. You shouldn't be in boardrooms here and saying, hey, I have this much money, create a program, make me look good.
Yeah. Mm-hmm. That's so true. It makes me think of this one person who used to work with the UN, and they specifically worked with the humanitarian sector. So they were working in like emergency response, and they were saying it sucks because a lot of people, they'll donate to like the Haiti relief, or things like that. And they said what sucks is if you can actually look up the breakdown of funds of what parts of like the needs of that country they're funding. And a lot of people will earmark what they're donating, right? And so, for example, Haiti, let's say they need clean water, money for clean water initiatives, but people will earmark it for like education. And maybe at that time in that community that the money's going towards, that's not their priority, right? And so, but they have to, because that's like what it was earmarked for. So the money goes into education, but then like, what about the clean water? Kids are dying because they're not getting clean water. Yeah. So it makes me think of that, and there's a lot of work to do.
There's a lot of work, but there's some folks doing some really good work. And I think it's just a lot of time aid work gets a lot of bad name because of this kind of mentality of like the money coming in at the far end, people are collaborating, but really this is an equal relationship. But there's some people who are doing some great work, and especially some locals, people who are not waiting for the West intervention. There's people who are on the ground doing a lot of great stuff.
Do you have any examples that come to mind of something like that?
Yes, I do. A friend of mine that's in Liberia, she's Liberian. She moved there. She's lived there. She's been doing this education initiative called KEEP, and she does stuff around young students and reading and literacy. And she's been working there for years. And a few years ago, I think there was this big NGO called More Than Me that was working with some young girls in Liberia. It was like an example of like aid gone terribly wrong, where the girls they were protecting got raped, and there was HIV and AIDS infect. It was terrible. It was like the worst NGO thing you could think about. And people kept saying, well, international aid have to come in because there's nobody doing anything. And I felt terrible. I was like, my friend has been working in this particular line with young people for the longest time. Her organization is called KEEP Liberia. And I think it's like Kids Engagement Educational Project. And they do some great work. Her goal is to build libraries because the war destroyed a lot of libraries, so there's not a lot of books. And she comes to the States, she collects some books, like actual kids' books, not just like any random book people are trying to get rid of. And she's trying to get them to rural areas, and she's trying. I think that's just one example. A lot of different people are in different sectors doing different things all across the continent. And I think we should highlight those instead of just saying international aid is not working. I mean, some international aid, they should just be partners. See, if there's like a big organizations that have money and they have books, because she paid like at least $4,000 to ship her books there. So that sort of money, if someone's like, okay, I have $5,000 for education in Liberia, instead of going there and giving her backpacks, they can just help her ship her book to what's already working. So I think those are the kind of things, like it works when you know what's already working instead of reinventing the wheel. A lot of people reach out to me and say, I want to do some aid work in Liberia. I don't know where to start. And I'm just like, first of all, what skills do you have? Like I don't want you to just get on a plane and go to Liberia and say, here I am, I'm here to help, because then you'll be in the way. But if you have some sort of skills, like if you're great with marketing, you can help an organization and help them build their page and market and do all that stuff you can do. If you are engineer, you can go. There's a lot of things that's lacking that you can help build. So I think there's a lot of different ways people can collaborate.
Yeah. So what, given your wonderful insight into all these issues, what do you hope to translate all of that in your PhD work somehow?
Yes. So I'm still looking. Obviously, this is my first year, so I have some time. I'm told people change like 300 times before they get there. But I'm really hoping to do some work around study abroad and representations of the continent. I think a lot of all of these international programs, like my school now, have over 100 programs that we do. So I'm hoping that to look at just how it's marketed, how people are going to the continent. Sometimes a lot of the study abroad posters are just like terrible. Some lady with baby on her back and some like a tree or like
I know exactly what you're talking about.
What does this have to do? Like people carrying water on there, and it's like, okay, I know you want. So I feel like the white savior complex that we talked about at the university level, I'm looking around like the theory of, are we reproducing those right here at the university? Are we telling students like, go to Africa and be a savior? Because we're like, look at the images that you tell, look at the stories that you tell. As a teacher, you're saying like, people in third world countries have nothing, so you have to go and fix it. Is this what are we really doing that? So I think I'm looking at ways to build more ethical, like study abroad programs and international experiences, especially to the continent. So in that realm, like I'm still, like I said, I'm still taking classes. I'm not into like my field work yet, but hopefully I can get to the point where I can at least make some impact on how people travel to Africa. If it's not just for study abroad or any sort of international experiences, a lot of people want to volunteer. I get this all the time. Like they want to go to Africa. They want to go to Africa. I want to go to Africa. Everybody, black, brown, because obviously this is helpless, place that people want to be. And I think like if you don't have the experience, you don't have the skill. It's a lot of money. I don't go home often because it's a lot of money. So I don't know how people are just spending money to just get there and take pictures and come back. So I think intentions versus impact is what I'm looking at. Like people have a lot of great intentions, and we can just, work on those intentions and make it better. Yes.
That's really interesting. And then how you said you decided to pick up the MPH degree as well.
So I am doing the education track for the MPH. There's 2 tracks. They have the epi track and the education. And definitely, like I said, I experienced part of the Ebola crisis, and I think a lot of it was like education around that. And I would like to incorporate that into my, because if I'm into my dissertation somehow, just looking at education policies, health education policy, especially in in developing countries like Liberia. I'm looking at ways that we can get message out better. I think a lot of times it's just like, don't have sex, and they have this big condoms on like a poster somewhere. And I feel like that gets the work done somehow, but it's just like a lot of scare tactics. Like the messaging, I think I'm looking at mostly the images and the messaging in our education program, our health education programs. Yeah.
That's awesome. Is there anything that we haven't touched on that you really feel like you want to say, or?
No, I think you guys touched on everything. I think the stigma around like diseases that people don't know about, like the coronavirus, the same thing with the Ebola. I think people need to educate themselves. That's very important. And I think people need to start just jumping on the plane to go to Africa. First of all, what part? And second of all, I think people need to be nice to your neighbor here first, and then you can jump on a plane and go far away. I think international aid is great. It just needs to be done in the right way, and that starts with collaborations on the ground. I think I cover just about everything.
Awesome. Well,
thank you.
Thank you so much for sharing your experience and your thoughts. And it's a lot to digest, but it's like good stuff.
Yeah, thank you. Thank you guys for having me. Thank you guys so much for anything you guys are doing to educate people while listening.
Thank you.
Thank you.
And that's the episode. Thank you so much, Zuleka, for talking with us. As a reminder, you can reach her at Zuleka, ZULEKA _ on Instagram.
The resources and transcript for this episode are up on the website.
As a reminder, if you have any questions, you can always reach us at globalcaveat@gmail.com or on Instagram and Twitter at globalcaveat.
And a big thank you to all of you, our listeners and supporters, for helping this podcast run. And a special thanks to Cordell Glass Hot Cocoa for producing our music. Thanks for listening.